The panel is about eradicating violence, essentials that do not leave people behind. And we just come out of a federal election with debates. And we've also heard announcements by the Minister of Public Safety in Quebec, and we're hearing the debates going on around the city of Montreal. And in some, none of these politicians have, while they've expressed concern about handguns and gender-based violence, none of them are talking about evidence, and none of them are talking about the transformative actions that we're going to talk about today to put that evidence into practice. So I'm going to say just a little bit about violence prevention and essentials before turning over to the three pathfinders that we have with us today. In Canada, there is one violent crime for every 15 adults. Those vary from assaults to much more serious offenses. And it's, of course, assaults that are the most common, both in the home and not in the home. But when we look at homicide victims, we get a bit more information. 1 in 4 of those are Indigenous, 1 in 6 are Black. And we also know that 1 in 4 are gang-related and 1 in 5 were killed with handguns. I like a particular diagram that Ontario has been using for the community safety and well-being plans, because it basically divides our way of dealing with crime into 4 ways of doing it. 1 is the incident response, which in Canada we're spending about 15 billion on policing, and another 5 to 10 billion on courts and prisons. It talks about the diversion, the hubs that Dale McPhee really pioneered for us. And then it talks about 2 ways of getting upstream and to tackle the causes. One of these is social development, and you only have to compare Toronto with Chicago to see how important social development is. Both cities with 2.7, 2.8 population. And unfortunately, Chicago with 700 homicides in a year, a 50% increase from 2019 to 2020. And Chicago has about 2.5 times the number of police of Toronto. And of course, it has, like everywhere in the United States, levels of incarceration that are unknown anywhere else in the world. And Toronto, with its modest but costly number of police, only has 70 murders. Undoubtedly, the main explanation is the social safety net, but you can also point to guns and other things. The other form of prevention, or the one that I'm going to talk about in the next couple of minutes, is about what has been proven to stop crime within a relatively short time period, 1 to 3 years. Now, we are living at a time when we have access to an amazing accumulation of knowledge about what has been effective in preventing violence. This is available from the World Health Organization that is in the panel competing with us. It's available, ironically, from the US Department of Justice, from Crime Solutions, but it's also available from commissions, which traditionally in the US deal with mass incarceration and policing. But my favorite one is actually the UK Youth Violence Commission, which was very much the midwife for the City of London and England to adopt the strategy they did. Next slide. So we know in problem places that there is a lot we can do. My favorite is actually a British program called Youth Inclusion, but we also have our own Stop Now plan and others. Next slide. We know that prevention in schools and universities can be very effective in reducing intimate partner and sexual violence, which cumulatively is more costly to victims than the sort of violence happening in the streets. We know about fourth hour an Ontario invention, but we know about others. And the headlines from the University of Western have really brought home to us what this means. And I think they will get some action from university administrators, but this has a lot of potential. Next slide. In the health sector, we know that outreaching to victims in hospital emergency rooms, which, by the way, was part of the Glasgow strategy, we know that this gets very fast, very cost-effective returns. And we could talk about the epidemiology of violence, the so-called Cardiff model, and there are others. Next slide, please. In policing, which in the period, the decade from 2000 to 2010, the costs of policing, not the numbers of police, the costs of policing went through the roof in Canada. So we're now paying more than $400 per capita for those policing services. And this is important because 2/3 of police are employed at the municipal level in Canada. And this huge increase in the cost of policing basically crowded out intervention and prevention. So what we know is that we can use current police resources much better. We can have better problem-solving policing. We can get police to control facilitators like knives and guns and alcohol. Next slide. Now, these wonderful things that actually prevent in the short term and are cost-effective and are readily available are not widely known, and they're even less widely used. So we have to talk about the essentials for getting them used. And I believe in 7 essentials. In the interest of time, I've just mentioned 3 here. We need leadership, and we're going to hear about that for Toronto and for London. But we need the human skills to do the planning, and we need, more than anything, adequate and sustained funding. We can't go on with time-limited and small numbers of projects. Next slide. So Canada, we have modestly developed some pathfinders. The Alberta strategy for 2006 that lasted 6 years with $1 billion spent. It's very impressive. Not all of that on prevention. It was spread across prevention and policing. Was undoubtedly a world leader. And unfortunately, it was abandoned for no very good reasons in 2013. But we've had other pathfinders, Waterloo Region starting in the 90s, Edmonton starting in the 2000s and others. We also have the remarkable legislation in Ontario, part of the Police Act called Community Safety and Wellbeing, and municipalities trying to do this. But we can learn a lot from US cities, and particularly their failure during COVID with this 20 to 30% increase. And as I mentioned, Chicago had a 50% increase. And this basically shows that you can't solve these problems by more police or by incredibly levels of incarceration. Next slide, please. So prevention is affordable, but you've got to spend some money on it. I believe it should be equivalent of 10% of police costs. The parliamentary committees in the 90s, chaired by Conservatives, recommended 5%, but we never did it. So we now need to catch up with 10%. Prevention is popular, with 60% of Canadians wanting it, and sort of prevention provides safer and less cost. Now, Canada is already committed to significant reductions in crime through its commitment to the Sustainable Development Goals. And just last week, the UN General Assembly heard a pitch from the Secretary General calling for a 50% reduction. And I believe that we can achieve a 50% reduction in this country within the next 5 years by learning from the folk who are going to be speaking in just one moment. Next slide. So let me introduce our first panelist, Denise Andrea Campbell, who is the Executive Director of Social Development, Finance and Administration in the city of Toronto, Canada's largest city, 2.8 million, and the center of much of business and other innovation. Denise has an impressive career with the City of Toronto, starting as a community development worker in 2004. She led the Toronto Strong Neighborhoods Initiative, and she has held many portfolios in community resources. She has a master's degree in voluntary sector management. She's established a reputation as a passionate transformational leader, able to build agreement across competing interests. And nothing could be better for somebody who is going to be championing a community safety well-being plan, where one of the major challenges is going to be to get the funding where it is needed and not just where the special interest groups want it. So Denise, you have 15 minutes.
Thank you so very much, Irvin, and good morning. I want to thank you all for the opportunity over the next few moments to share the new comprehensive 10-year community safety and well-being plan for Toronto, the fourth largest city in North America and the largest in Canada, SafeTO. Next slide, please. So Toronto's community safety and well-being work has evolved over time. Each bold step has been informed by the on-the-ground realities and lessons learned along the way. I just want to take a couple moments, just quickly highlight some of the key steps in this journey. So in 2005, we had a very difficult summer with record levels of gun violence and 52 related deaths. In response, Torontonians rolled up their sleeves and got to work on solutions. That year, the last City of Toronto safety plan was developed, articulating community safety as both requiring enforcement and prevention. This early plan paved the way for many social development initiatives, especially those focused on investments in the city's 13 priority neighborhoods at the time. And to complement the work, the city launched the mayor's safety plan and a safety task force, which convened system leaders to ensure that our efforts were coordinated and maximizing our investments. We launched a community safety secretariat that led to the development of the crisis response program, the city's flagship response at this point to gun violence. And we started to supporting residents impacted by violence to recover and then rebuild crisis response protocols and networks. In the 2012-2015 era, we launched Focus, Rexdale, and Spider hub models that are focused on reducing harm and victimization in partnership with United Way and the police. And as you see, in 2014, we started multi-year equity-based strategies aimed at youth most vulnerable to involvement in violence and crime, poverty reduction, and in 2017, our Toronto Action Plan to confront anti-Black racism. The global pandemic and the global move for Black lives also propelled our work again over the last year and a half, with a growing focus on reforming police, as well as the development of a community crisis response model that is an alternative for responding to mental health. This year, in July, Council adopted our 10-year community safety and well-being plan. Next slide, please. So amongst this growing body of work at the City of Toronto, communities have called on us to reimagine the core elements of community safety. They've asked of us to shift from a reliance on relative reactive emergency response to a culture of proactive prevention. In 2019, community calls for the city to reimagine community safety became strengthened, as Irvin noted, by the provincial legislation that recognized the complexity of community safety challenges and the needs to respond with multi-sector approaches, emphasizing social development and prevention. So under the Police Services Act 2019 and its forthcoming successor, the Community Safety and Policing Act 2019, all Ontario municipalities are mandated to prepare and adopt a community safety and well-being plan this year. Toronto engaged with others to develop the provincial framework that guided municipalities to this broader view and to center the well-being of individuals, families, and communities through long-term strategic actions that ensure community safety and well-being. As we all know, the root causes of community violence, trauma, and injustice are complex. And so a traditional enforcement approach cannot be the only response nor the default response to building a safer Toronto. Next slide, please. So SafeTO was informed by research and extensive engagement, stakeholder engagement and consultations. To inform the engagement process, my team partnered with our partners here for the conference, the Canadian Municipal Network on Crime Prevention, to do a jurisdictional review of 12 Canadian municipalities. We also looked at an additional 4 Canadian and 7 international cities doing related work. We did research in the area of community safety and well-being and reviewed deputations on community matters to various City of Toronto standing committees over the last 4 years. We also conducted analysis of relevant sector data from the Toronto Police Service, and as well as our existing city-led hub programs focused on situations of acutely elevated risk. And then from November of last year until April of this year, we engaged in extensive community consultation. We engaged with population-specific, issue-specific, and geographic-based consultations, as well as 18 city divisions, agencies, and corporations. We knew that this had to be a whole of government and whole of community approach if we were going to think differently, boldly, and work across sectors to actually make meaningful change. In total, 2,500 stakeholders were engaged, including written submissions, and a public health survey in March received an additional 1,500 responses. So communities told us that we need to prioritize those most adversely impacted by community safety and well-being challenges, that culturally rooted responses are critical, that identity matters and a sense of belonging is critical to the well-being of residents, and that we shouldn't just focus on interventions, but also on the culture in which services are developed and provided. And finally, people said they wanted tangible actions, transparency, and accountability. Next slide. So through that consultation and engagement process, 6 guiding principles emerged for this work going forward. And I just wanted to highlight 2 of them. Embed an access, equity, and human rights approach that is grounded in a commitment to advance reconciliation and confront anti-Black racism. And do no harm. Community safety, in the ways that Toronto is approaching it, is an equity issue. And so systemic discrimination has negatively impacted how Indigenous people, Black, and other equity-deserving communities experience community safety in Toronto. And so efforts to address safety and well-being must consider the needs of those most negatively impacted and the systems and structures that impact residents. So we need to understand how poverty, racism, and other structural inequities impact risk factors associated with safety and well-being, such as exposure to violence, grief, and loss, or lack of affordable housing, and protective factors, such as education or financial stability, can help to prioritize the actions that will have the most impact in bringing about a safer city. Next slide, please. So through the review of data, including past and current consultation data, 4 interconnected priority challenges have been identified that must be addressed in the work. Community trauma, including multi-generational or intergenerational racial trauma and early trauma as a result of adverse childhood experiences are part of it. Community violence, including gun violence, gender-based and intimate partner violence. Harm and victimization, which includes both experiencing immediate and lifelong harms or repeated victimization. And injustice, including the overrepresentation of Indigenous, Black, and equity-deserving communities in the criminal justice system, the lack of consistency in applying a community justice lens to root causes, and the need to embrace more restorative practices. Excuse me. Next slide, please. So where does this bring us? So SAFE-TO is a comprehensive 10-year plan that requires a fundamental shift in thinking and acting in order to transform change in our city. It's a roadmap for how the city and social service systems that serve Toronto, such as community services, healthcare systems, education, justice, police, and business, can work collaboratively across these different sectors and across governments to support the safety and well-being outcomes that Torontonians desire. It inspires us to think differently, work collaboratively, and to do better to bring about a safe Toronto that promotes and celebrates the well-being and resilience of all residents. At its core, it's about collectively shifting our culture and transforming our systems accordingly. Next slide, please. SAFE-TO will drive 26 priority actions across 7 strategic goals to create a safer Toronto. Those 7 strategic goals include reduce vulnerability, reduce violence, advance truth and reconciliation, promote healing and justice, invest in people, invest in neighborhoods, and drive collaboration and accountability. Next slide, please. Other way, I think. Yeah, thank you. At the outset of the presentation, I shared a snapshot of our journey over the last 15 years. We have identified over 60 existing city-led strategies, programs, and initiatives that are actively working currently to address elements of community safety and well-being. Despite this existing robust infrastructure, however, we have key limitations at the city. And so we have been mobilizing investments, programs, and services across that spectrum from emergency response to social development, but they operate largely independently from each other with little intentionality of how lessons learned can inform ongoing prevention and social development approaches. So SAFE-TO provides a framework that is allowing us to connect these dots and inform a culture shift to pursue a more comprehensive and holistic approach to community safety and well-being. SAFE-TO will bring together existing city strategies and programs under one umbrella with new priority actions moving forward. So for example, the 5 proposed priorities for year 1 under SAFE-TO, which is 2022, it builds on work that is already underway at the city. So we will deliver the community crisis support service. This is an estimated $11.5 million investment next year to launch 4 pilots as an alternative to police-led mental health calls. We are developing a comprehensive multi-sector violence reduction plan that builds on work that we've been piloting across the city, the police, the school boards, our transit commission, in order to manage and reduce gun violence this summer with some promising early outcomes. We're developing a comprehensive gender-based and intimate partner violence reduction strategy. We need to become a trauma-informed and responsive city. And we're developing a comprehensive strategy to share, integrate, and analyze data across multiple institutions for the purpose of informing real-time policy development and service planning. Next slide, please. So how does this all come together? It's one thing to have a plan, it's another thing to make it happen. So we are literally driving the car as we are building it. SafeTO will be reporting back to Council in December of this year with our implementation plan. That will include the details and the structures required to advance the goals and the priority actions. Along with the timelines, identification of city divisions or city agencies as lead on actions and intended outcomes for all actions will be part of the implementation plan, including 4 specific approaches. We need an investment approach. SafeTO will require dedicated resources to lead implementation, coordinate critical partners, manage implementation issues, and ensure ongoing community engagement and report on outcomes. We also require new investments for our community partners. So we're in a budget time, as you can appreciate also at this moment in time. So we are working on a placeholder funding envelope for the investment into the first year of the plan, while we are corporate planning is underway. We need a governance structure and an operating model. Addressing community safety and well-being extends beyond the program and policy levers of the city only, and it requires the active engagement of our across our organization and in community and in other sectors. So this is an opportunity for us to be bold and to build and launch a new governance structure, including an advisory that engages multiple sectors in the shared work of building a safer Toronto. We need an intergovernmental strategy because no one can achieve the goals of safety alone. And intergovernmental alignment, engagement, and investment is absolutely critical to moving forward the priority actions. And then finally, and critically important, we need a SafeTO indicator framework. We are designing such a framework in collaboration with Toronto Public Health, Toronto Police Service, and the Population Health Analytics Laboratory at the Dalla Lana School of Public Health at University of Toronto to guide real-time decision-making and help us drive towards outcomes. I think that's it for my overview. I want to thank you, and I look forward to questions when we get there. Over to you, Urban.
So thank you so much, Denise. Split-second timing to go along with a split-second series of presentations. It's really exciting what you're doing. It's really exciting to hear the enthusiasm for it. Just before we move to the next speaker, I should have told the audience that if you have questions, you should put them in the chat. You will also find in the chat some links. So I think Scott McKean, who works for Denise, has been putting some links in the chat for you. I know, Denise, that we'll be coming back to many of the things you've talked about, particularly the goals and particularly your plans for the first year and your investment strategy, your governance strategy, and how you're going to get money from other orders of government who only seem to want to fund projects and not really invest. I will, of course, be interested in the indicators, but it's very, very exciting. And as a Canadian, it makes me feel proud that we have a model that we can actually say, go look at what Toronto's doing. Toronto, in the world I live in, is a relatively low violence city. Yes, it's much more violent than UK cities, but compared to the US or Latin America, it's a very boring city with low violence. So that you've chosen to get to these issues, and particularly for this group that you refer to, the Indigenous Black, and it doesn't run off my tongue like yours, this deserving equity group. So a lot of for us to draw you out on later on. So if you're in the audience, don't hesitate to put questions in chat, and you can do this while we're continuing. So we now have a special treat for you. Flown in this morning from London is Liv Peck, Director of Violence Reduction Unit in the United Kingdom. I think what's most important for me about Liv Peck is that she has 18 years as an elected city councillor. So she's not an academic, she's not a city official, she's somebody who engages in getting elected and in political action. She was the leader of the London's borough of Lambeth for 6 years, setting strategic and political direction for the borough. She prioritized Lambeth's pioneering work on challenging violence against women and girls, an important theme for us in Canada, and supported the development of a public health approach towards violence. So this is not just some vague reference to public health, this was supporting its implementation. She was the deputy chair for London councils. It's the body that represents all those London councils and boroughs. And she led them on crime and public protection. She was also deputy Labour leader of the local government association, and I'm sure she will talk about her mayor. Her mayor, Sadiq Khan, was re-elected after they started their crime reduction policy, and I think this is very important for us in Canada to realize that there are politicians who are keen on getting this stuff to happen, and that a mayor of one of the world's largest cities gets re-elected despite having decided to invest in effective violence reduction. So over to you, Lynn.
Great. Thank you very much. I am, just in case you didn't pick up from Irvin, I am actually sitting in an afternoon in a London office where disconcertingly the lights keep going off. So if I suddenly go dark, I will just have to move my chair to make sure they start again. Thank you very much for inviting me. It was really, really interesting to listen to Denise's presentation and really concur with that sentiment that you know, you're building a car as you're driving it, and certainly we feel as if we're very much just coming off the starting line, having only been set up relatively recently. I'm going to try over the course of the next 15 minutes to just give you a bit of a flavour of what's happening in London, the complexity of some of the stuff that we're working with, and some of the programmes and partnerships we have developed, and then obviously very happy to take questions. So if we could go on to the first slide, that would be great, please. Okay, thank you. Well, Irvin has already mentioned that the Mayor of London is a Labour mayor who was re-elected earlier this year. He had a 4-year term from 2016 to 2020, but the election was postponed as a result of the pandemic. But back in 2018, in his first term, he decided that he wanted to set up a violence reduction unit. And that was very consciously a nod to looking at some of the work that had happened elsewhere across the UK, and very particularly in Scotland, where for over a decade they'd prided themselves on a public health approach towards reducing violence, and they'd seen some really phenomenal results. So it's very much a sense of putting prevention on the agenda, and prevention being an absolutely key tool of how you reduced violence. Now, since its creation, the Violence Reduction Unit has received and has got in its receipt a fairly constant stream of funding from the Mayor, which, as we'll go on to later, is, I think, really important in terms of longer term work. And to date, that's resulted in about £35 million, as you can see from here. We were also then benefited, literally just as we'd started work in May 2019, from the Home Office, which is the government department that oversees policing and such, deciding that it was also going to contribute to the Violence Reduction Unit. And even better than that, that London having been the first set up in England and Wales, that they were also going to look at setting up 17 other units of different size and different complexity, but nevertheless 17 other units across England and Wales. So I think quite an indicative approach that there was something missing from what was already being done to challenge violence, and that's something that we've really welcomed. And as Irvin mentioned earlier on, was very much the kind of brainchild not only of the Scottish experience, but also actually from the Youth Commission report that had gone through Parliament. Now, we are lucky in that we do have that funding guaranteed from the Mayor, and we are looking in our up-and-coming comprehensive spending review from government for a similar level of national government support, because having been set up to look at the causes of violence, having been and to work on really eradicating those long-term drivers, alongside making sure that you're establishing prevention and early intervention, it's pretty important that you have a clear sense of what resources you've got going forward. And I was interested again in Denise's point about how important that was for her as she sort of tackled her 10-year plan. I'll come on to in a bit more detail the importance of partnership as a kind of ethos of the unit. But in setting up the unit, one of the key things was saying that this is not only something that needs to look at prevention right the way through to enforcement, but it really needed to do so with a huge range of different players and partners across London. And so the Mayor chairs a board at which all of the leaders from the key public sector organisations that you would expect are represented. So NHS, which is the National Health Service in London, the leader from who represents all of the London local authorities, a lead for education, and a lead across the Metropolitan Police, which is our London police force. If we could move on to the second slide, please. Brilliant. So the aims of the VRU, well, there are 3 aims of the VRU, and I think you probably need to press the button again to bring them up. Right, the first is a pretty obvious one. It's to reduce and stabilise violence across London. But it's also trying to do something from a more sustainable perspective. It's looking at how do you build feelings around safety, because a lot of the perception of violence is sometimes doesn't accord with the reality of violence. And then thirdly, and this was a really important principle, I've talked about public sector partnership, but absolutely, clearly at the heart of our work has to be how are we drawing in the communities from across London, how are we working with them, how are we putting them in some cases in charge of developing solutions, but how are we always working with them as opposed to, working and telling them, which is very often, I think sometimes that can be the public sector approach. And at the heart of that is the partnership, the advocacy around what change needs to happen, and the investment. And if I could just go through a couple of key facts there before delving into a little bit more detail about what we've done. So to give you a sort of sense of scale, just in our financial year from over 20 to 21, we commissioned 126 programmes and projects. Many of those were evaluated. We invested, as it says there, about 19 million on those investments, and we calculated that we reached about 80,000 young people in London. So hopefully that gives you some sense of scale in terms of what we're managing to do. And now as we move into looking at the challenges from the pandemic, which I hope maybe we've got some chance to look at in the questions, we as a unit are playing a key role in London in leading on one of the Mayor's key recovery missions, which is a new deal for young people, recognising that they were very badly impacted on through the pandemic. Okay, if we could move on. Great. So the reason for setting up the unit was obviously seeing good practice elsewhere. It was the importance of establishing prevention, but it was clearly against a backdrop of rising violence in the city. This is a fairly stark chart that really only gives you one sort of look into violence, one metric, which is, and probably the most important, which is, how many people have lost their lives to violence. And what we saw in 2018 when the unit was first announced, was a gradual, the culmination of a gradual increase. You can see those figures are just going up. And then in 2019, a real peak for London, and that's 150 deaths in a population just over 9 million, and that was a 10-year high. One of the first things, and the profile of that is really around an increasing number now of teenagers representing that overall figure. So we've thankfully seen a decrease in the number of homicides since the Violence Reduction Unit started work on a partnership approach. But what we're now worried about in 2020 and 2021 is an increasing number of teenage homicides that are represented in that overall figure. Of course, there are many other statistics we use to analyse impact. You know, under 25s, violence against the person, numbers of entrants into hospital for violence-related injuries. And at the same time, while we've got all those shorter term measures that are important and are evaluated by the Home Office for the success or otherwise of our work, we're really keen not to lose one of the reasons we were set up in the first place, which is that longer term approach and how you quantify the impact of prevention. We started by developing a strategic needs assessment, and that became a really good template for the kind of areas that we needed to be working in, as well as the things that we thought were key drivers of violence. And it's that provided us with a context. If we could move on, please. Okay, so I've mentioned some of this before, but our approach is very much around rooted in prevention and early intervention. It is understanding from a contextual safeguarding point of view that we really need to work with people, but we also need to do so in the context of place. That the underlying causes of violence are incredibly complex, and they are impacted, that the impact of things like poverty are absolutely there, but are very hard, I think, for us as a sole unit, or even sometimes as a partnership across London, to eradicate. We are very keen to make sure that the way we work is investing in programmes that support young people and support youth workers, parents and schools, and that we really put the voice and opinion of young people and communities really at the heart of doing that. And so the way we have approached that is very much looking at the journey of a young person and thinking, what are those key moments which could either translate into positive opportunities or could actually be those moments of challenge. And that's how we framed, I think, our partnership work is also how we framed our working programme. So it's all very much around positive opportunities for us. We could move on. Okay, so to explore the partnership more, and perhaps to give, first of all, a little bit of context here. So London has a population of just over 9 million people. It is divided into 32 local authorities, all of whom have their own political leader and their own, obviously, executive staff. We have 12 divisions of the Metropolitan Police, and we also have 5 health authorities that encompass all of that area. And that's even before we get to diversity of community or diversity of wealth, diversity of experience. So there is a lot of joining up to do, but we have really prioritised working with some of the leading public sector partners that you would assume. So the NHS, education providers, councils, I've mentioned the 32 boroughs, youth services, and the charities and civic society, alongside, of course, one of our key partners, the police. If we could move from partnership onto the next slide, I think that would be helpful. I just wanted to delve into a little bit more those local councils, because it's really important for us that even though we have a political mayor, it's obviously a representative, a political representative, it is really important that we are working across all the 32 boroughs in London, and we've worked hard to engage with each of those. And one of the ways we've done that is by developing with them a violence and vulnerability action plan. That is our attempt to try and standardise practice across London. albeit it needs to still be reflective of the very different communities. And it's really important for us to embed in that the diversionary work that needs to happen, as well as the positive activities for young people. And in setting that template, we work very closely with the Met Police, we work very closely with the heads of community safety and all of the different directors of children's services and the NHS across London. Those plans are then assessed and they really become the template for our work at a very local level. If we could move on to the next. So I wanted to give you some flavour of kind of the programmes that we've been supporting. And I think these give some examples of them. The first is I've talked in units of 32 because those are local borough councils. We all know, and it was certainly indicated from our strategic needs assessment, that it's actually neighbourhoods within those councils that are actually the real issue. And I know that from my experience of Lambeth, where I was the leader. And so we've developed a flagship programme which is really looking at 8 key neighbourhoods across London where they've got particular challenges. And rather than go in with an intervention, we asked local community groups to come together, present as a consortia, define the area, define the problem, and then we are supporting their initiatives. We are supporting them with public sector support to advance violence reduction measures as well as build community resilience. The second is a good example of partnership working at a pan-London level. This is something we've recently secured funding for. So we are looking to deliver interventions for up to 2,500 children and young people at the risk of serious violence. And we've got a targeted now 3-year programme of high-intensity CBT training for some of those professionals working with young people, but also obviously for those young people themselves. Another area that I think we have spent an enormous amount of investment time around is youth work, really prioritise the relationship between a trusted adult and a young person, and often see that, particularly in adolescence, as the key to supporting a young person and giving them positive opportunities. And what we've done there is embed, I suppose, a training course for 200 youth workers across the capital around the kind of specialist skills that they're going to need. Very depleted workforce, our youth workers, as a result of austerity. But yet, nonetheless, those are very often the people that provide the skills that we need. And we do that within a hospital setting, we do that in custody suites, and we do that out in the community. And then finally, the setting that we think is hugely important, of course, is education. One of the things we were taught when we went up to Glasgow and spoke to the people in Scotland about what they've managed to achieve was how many, the correlation between numbers of young people who had been excluded from school and rates of violence. And over a 10-year period, they had really dramatically reduced exclusions, and they'd seen a real dramatic correlation in reduction in violence. And so getting into schools, leading on healthy relationship programs, leading on inclusive education, and at the same time then supporting the young people who have been excluded has been an absolutely key main part of our work. So hopefully that gives you a sense of some of the things that we're investing in and that we're evaluating. And then I think the final slide. Yeah, so our conclusion and our rationale is very much that violence is preventable and not inevitable. And I think we're all hopefully in a comfortable and shared space in this conference around that. But we really, I've mentioned, but perhaps not dwelled on throughout this, that young people, we do feel, are very much at the heart of trying to develop and inform and shape some of our programmes. And this is a photo taken with the mayor. He's possibly the shortest person in the photo. He is very, very small. He's in the dark, in the light blue suit there. Yes, thank you very much. And that's with our Young People's Action Group. And we've gone out to work with a group of young people over a year. We've recruited, and we're providing them with pastoral support and pastoral development, but in turn they are really giving us their views and their experience in terms of shaping all of our programme, and they are really our key partner throughout all of this, and they're the key shapers of programmes, alongside what I hope I've, in a fairly short amount of time, managed to condense in terms of the research as well as the bigger partnerships, and as well as the investment programme. So we're very excited as to what might come over and what might happen in the next couple of years. We've got an enormous amount of enthusiasm and energy, I think, behind us across London. There are myriad of community groups doing fantastic work, and really our challenge is that consolidation. Actually, it's our challenge to change the narrative, and I think it's our challenge to show through the work that we're doing that we can really make a difference. So I shall leave it at that, but thank you very much for the time to talk to you a little bit about what's going on in London.
So brilliant. Thank you so much, Lib, covering so much ground, re-emphasizing the importance of a multi-sectoral approach. I heard you talk about evaluating outcomes. And I think it's important for us to see that this is in a city of 9 million. That's roughly 3 times the population of Toronto. Just for people who don't live thinking about pounds are not quite worth $2. So, but I think for us, it's particularly interesting to hear a higher level of government that is investing. Denise mentioned the need for intergovernmental, for all orders of government in Canada to contribute. So it's good that by our standards, a relatively conservative government is actually matching some of your funding at the local level. So just a reminder to people, if you have questions, please put them in chat. We will, I hope, still have time to have some debate between the panelists and with you. So let's move to Ariane de Palacio, who's the Director, Research, Innovation and International Relations at the International Center for Prevention of Crime in Montreal. Ariane has a PhD in geography, and since joining the International Center in 2017, she's led several international research projects and 10 technical assistance missions with UN agencies, including the UN Office on Drugs and Crime. Her current role at the International Center is to oversee content development, research projects, and international strategic development. She's also involved with a number of local projects in Montreal that combine multi-sectoral planning and mobilization of local and community agencies. So you have the floor, Ariane.
Thank you, Irvin. I'm just going to share my screen. Thank you. First of all, thank you to the CMNCP for the invitation. It's highly appreciated. I'm going to try to be not too boring after those 2 incredibly interesting presentations, and I'm going to try to not take too much of your time, also to be able to exchange with you all. And as Irvin was mentioning, I mean, although we are an international center, I'm going to talk to you today from this perspective of a Montrealer and someone who works in Montreal now in a large portion of my time. So, first of all, I just wanted to maybe make a little point around violence in Montreal. For those who know the situation that we're facing here, violence has, really taken the front of the public debate here in Montreal, with a whole discourse and narrative around an epidemic of violence, an explosion of violence, youth violence being out of control in Montreal's neighborhoods, in communities, especially those facing the greatest challenges in terms of social, economic marginalization, discrimination, and overall systemic discriminations. So maybe just to put things into perspective, I just wanted to maybe look at hard data to maybe have a bit more of a context of what we're living here in the city. So if we look at the 2 last years, and a lot of the narrative around youth violence in Montreal has been around a sharp increase of perceived violence in the 2 last years. So let's say since 2018. Actually, between 2019 and 2020, crimes against persons have remained quite stable. And in the context of the pandemic, we can assume that, of course, reporting rates have been affected. So if we look at those crimes difficult to hide, such as homicide, we also see that they've been stable. The only type of interpersonal violence that have risen are attempted murders that have risen by 7.4%. But otherwise, other types of crime, of violent crime, have really been stable. And regarding youth violence against assault and threats, have actually declined between 2019 and 2020 after a relative raise in 2018-2019. However, it's the incidents involving a firearm that have risen by 14% overall, especially attempted murders and assault. So, and we see that it's not a question of if overall violence has exploded, like if we are facing like this increasing wave of violence in the city, but rather what type of violence has been really on the rise, and it's firearm violence. So one explanation for that is that we've seen a dramatic increase and aggravation of inter-gangs conflicts in Montreal over the last 2 to 3 years, with kind of a vendetta dynamic of violence and revenge that just really built up over the last few years. And an interesting fact about that is that victims do not cooperate with the police, and as a consequence, these events cannot be registered as assault or murder attempts, and rather they are registered as a firearm discharge. So if we look at firearm discharge, this specific category, yes, we see an increase from 45 incidents in 2019 to 77 so far in 2021. So there we see that this specific type of firearm or gun-related incident has dramatically increased. So this is quite telling that this so-called violence epidemic is actually very concentrated around criminalized groups in conflict with each other. We know that there is some territorial conflicts, and again, some revenge kind of dynamic that really took place and took over the relations between those groups. So in conclusion, the situation has nothing to do with a kind of a systemic epidemic of violence, especially youth violence. Hard data tends to show a relative stability in overall violent crimes. However, firearms have been playing an increasing role. More and more firearms are involved in assaults and murder attempts, and this is the most striking, visible part. It's the part on which the media focused. It's the part on which also the public attention is drawn to, and it's also the part that has an incredibly negative impact on communities. Firearms related violence has a huge impact in terms of traumatizing the communities where it happens, and these communities really have felt that in terms of their feeling of safety, the way that they interact with their environment, with their neighborhood, etc. And just to make a last little point is that, a very telling thing is that when you look at hard data, we can see that young people are actually mainly the victims of violence. And especially, for example, sexual violence disproportionately affects them. And when focusing on this gun-related violence, gang-related violence, that is really just the tip of the iceberg. And we tend to forget about the violence that young people are victims of, and that just really doesn't get the kind of visibility and prioritization that it should, especially in the last year. Sexual violence, cyber violence, school bullying through cyber violence, domestic violence, and violence toward children at home have really gone, hidden and unreported and underreported. And this is really something that I wanted to start with. So what do we do here at ICPC? We've been created more than 25 years ago. Since our creation, really, although we are an international center, we've had like really deep relations with our home city, Montreal. Right now, our action in the city really takes place through three main types of programs. The first one being the Montreal Urban Safety Program, where we conduct research and applied research innovation, evaluation. We do support evidence-based practices, tool development, research and analysis. The second one is the Réseau d'échange et de soutien aux actions locales. It's a youth violence focused network to foster exchange and support local actions. So it's really a very citywide, multi-stakeholder, multi-sectoral network of expertise around youth violence issues. It mainly provides knowledge mobilization, information services, and also technical assistance and support to community-based organizations, and also local and borough administrations, as well as a community of practice. And the third tool is really our projects in terms of technical assistance, whether they are provided for the city or the different boroughs. We've actually been extremely active in supporting the different boroughs of the northeast of Montreal, who are now facing the thick of this gun-related violence. And we support them through local safety audits, strategic planning processes, community participation and engagement, and also support to evidence-based and evidence-informed practices, evaluations, etc. So what now I just wanted to maybe, present and open to discussion was a little bit the challenges that we're facing as a community. And I say we because I consider our organization very much as a key partner, as a part of what the Montreal stakeholder system and communities have to face as a collectivity. So it's not only a matter of the responsibility of the city, or the boroughs, or the police. It's really a collective, kind of a collective reflection on how we can do better and face this situation, and what the main challenges are that we're facing in trying to adapt to this new situation and to find answers and responses. So maybe three types of questions there. It's first of all, how well structured are we to be efficient? And this is very interesting because it's going to talk to what the cases of Toronto and London have been also presenting in terms of how does the city organize its governance structure and its strategy in terms of multi-sectoral approaches. The second one is, how equipped are we to address violence? Do we have the right approaches? Do we use all the tools that exist and the evidence-based and evidence-informed practices that are out there? And the third question is, how innovative are we in order to better adapt to this situation and improve our response? So, first of all, in terms of structural challenges, I would say that they are of three types. First of all, a fragmented leadership. Here in Montreal, we don't have an intersectoral, for example, task force in terms of public safety or youth violence. It's the Department of Social Development and Inclusivity that really heads the efforts in terms of urban safety and youth violence prevention. However, there is no high-level group that would really put all relevant actors around the table. And so you can say that public safety, crime and violence prevention thus cannot be a transversal priority because there is no structure that really brings all relevant actors at high level around the table. Also, at borough level, strategic planning lacks integration from the city, like the main city administration, to the different boroughs administrations. And it's the boroughs that have the responsibility to develop strategic plans in terms of urban safety and youth violence prevention. So that leads us to our second issue, which is the problematic policymaking and strategic planning process. At city level, we have two programs, one in urban safety, which is Tandem, which is an incredibly good program, has been recognized as a good practice by different international agencies, has been around for 25 years. Of course, needs to be adapted, but overall an excellent program, and the youth violence prevention program, but there's no overall citywide strategic plan. The questions of urban safety and youth and community wellness and youth wellness are embedded within the resilience plan, which is a kind of an overall systemic plan for the city, but they don't have a specific dedicated strategy. At borough level, again, action plans are very unevenly developed. You have boroughs that are very advanced in terms of their planning processes, others that don't have an action plan or don't have an up-to-date action plan. There is no systematic approach to how the planning process should be done and what approach should be taken. So we can see very uneven results as a result of this lack of a framework for everyone to be on the same page. And last but not least, financial insecurity is a big problem. I'm so impressed that Toronto is aiming at a 10-year plan. If the funding can follow a 10-year plan, we all know that prevention efforts cannot bear fruit after 1 year, 2 years, or even 3 years. You need to give it time, you need to give it effort and prolonged effort, and evaluate and reevaluate and adapt and improve, and then maybe you'll see some huge change. But so far, financial insecurity have really been like a big challenge for everyone, from borough administrations, city administrations, and evidently community-based organizations, to really have a lasting impact. And then finally, well, it's a result of the two previous points, and it's the difficulty to build a shared vision between all stakeholders. First of all, of course, a fragmented leadership means that you have kind of a coexistence of fragmented perspectives and visions by different type of stakeholders. For example, public health officials and organizations are not quite involved to the extent that they should be here in Montreal, which I think it's really something that we're trying to push, having public health officials very much involved in the way that we address crime and violence. It's also highly territorialized, so as it's boroughs that bear the responsibility to develop those youth violence prevention action plans and urban safety action plans, well, it really results in a fragmentation in terms of territories, where one borough doesn't really articulate what they're doing with their neighbors. And we see these type of limitations right now with the violence that we're facing in the northeast of Montreal, because it affects at least 3 to 4 boroughs. And there is not yet a shared vision or shared strategy around what we're going to do about it. So when a criminalized group from one borough is at war with a criminalized group from the other one, you really need to articulate and to really form kind of an inter-territorial task force, which doesn't exist right now. And finally, it's highly political, and not in a good sense. It's been politicized when it should not be a question of little politics and electoral interest, but rather a deep engagement of the political leadership and the different parties and the different families in terms of politics towards having an integrated, long-lasting strategy in terms of urban safety and youth violence prevention.
You're running out of time,
yeah, no.
Ariane. So.
Oh, sorry. Well, I can just finish with this approach. So in terms of innovation, what we're trying to push with our partners is a threefold process to really shift and bring some structural change to the way that we collectively respond to these issues. First of all, adopt a violence reduction approach. So shift from a prevention repression dichotomy to a prevention reduction complementarity. Adapt approaches, of course, of peace building, de-escalation, violence reduction. Irvin mentioned some incredibly interesting approaches that have been developed among other places in the US. And also address violence-related trauma at community level and prioritize community resilience. So try to not only consider these issues as problems, but also look at how communities can, bring their resilience, their forces, and their strengths to be part of the solution. The second one is to implement participative and community-centered planning process. So promote vision-based processes rather than problem-based processes in the planning. Switch from consultation to full participation, especially in terms of young people, really center the planning processes around the participation of young people, especially those most marginalized, and adopt long-term strategies supported by long-term funding tools. And finally, integrate, fluidify, and break the silotype governance that is at play, creating multi-sectoral and high-level task force that would be a huge tool to advance these priorities, to support multi-territorial strategies, and to foster the adoption of a safety land in all relevant municipal processes, especially urban planning and urban design. And I will stop there. Thank you very much.
So thank you very much, Ariane, for presenting some challenges and starting with some possible remedies for those.